An ectopic pregnancy occurs when a fertilized egg implants outside the uterus, most commonly in the fallopian tube. This is a serious medical condition requiring immediate attention. In a normal pregnancy, the fertilized egg implants in the uterus. However, in an ectopic pregnancy, the egg cannot survive. Furthermore, the growing tissue can cause the fallopian tube to rupture. This can lead to life-threatening internal bleeding. Early detection and treatment are crucial for preventing serious complications. It's important to remember that an ectopic pregnancy is not viable. The pregnancy cannot be moved to the uterus, and sadly, continuing the pregnancy is not an option. The exact cause of ectopic pregnancy is not always clear. However, certain factors can increase a woman's risk. These include a history of pelvic inflammatory disease, previous ectopic pregnancy, and certain fertility treatments. Other risk factors include smoking, age over 35, and having an intrauterine device for contraception. While an IUD is very effective, if a pregnancy does occur, there's a higher chance of it being ectopic. It's also worth noting that women who have had surgery on their fallopian tubes, such as a tubal ligation reversal, are at increased risk. Damage or scarring to the tubes can make it difficult for the egg to travel to the uterus. The symptoms of an ectopic pregnancy can vary and may not always be obvious. Some women experience no symptoms at all. That is why early detection is so difficult. Common symptoms include abdominal pain, vaginal bleeding, and shoulder tip pain. The abdominal pain can range from mild cramping to sharp and stabbing. Vaginal bleeding may be light or heavy and may be mistaken for a period. It's important to remember that these symptoms can also be signs of other conditions, such as a miscarriage or a urinary tract infection. If you experience any of these symptoms, it's essential to see a doctor immediately to rule out an ectopic pregnancy. Section 4. Diagnosis and treatment options. Diagnosing an ectopic pregnancy involves a pelvic exam, ultrasound, and blood tests. The ultrasound can show the location of the pregnancy. Blood tests measure the level of pregnancy hormone, HCG, which can be lower in an ectopic pregnancy. Treatment options depend on the location and size of the ectopic pregnancy, as well as the woman's overall health. In some cases, medication can be used to stop the growth of the ectopic tissue. This is usually an option if the pregnancy is diagnosed early and the fallopian tube has not ruptured. In other cases, surgery may be necessary to remove the ectopic pregnancy. This is usually done laparoscopically, using small incisions and a camera to guide the procedure. In some cases, if the fallopian tube is severely damaged, it may need to be removed. If the fallopian tube ruptures, emergency surgery is necessary to stop the bleeding. This is a serious situation that can be life-threatening if not treated immediately. Section 5. Importance of early detection. Early detection and treatment are crucial for improving outcomes in ectopic pregnancy. Knowing your risk factors and being aware of the symptoms can help you seek medical attention promptly. If you have any concerns or experience any unusual symptoms during pregnancy, consult your doctor immediately. Early diagnosis and appropriate management can help prevent serious complications and preserve your future fertility. Remember, ectopic pregnancy is a serious condition, but with timely medical care, most women can recover fully. Don't hesitate to reach out to your healthcare provider if you have any worries or questions. Your health and well-being are paramount.